Hello and welcome to today's episode of Focus Atlanta. I am your host, Keisha Lance Lynn. Thanks so much for tuning in with us this Sunday morning. In this week's episode, we'll prepare you for the festivities of the Alpha Derby weekend. We'll discuss the importance of donating plasma, and we'll chat about heart-healthy tips we can implement into our everyday lives. We'll begin with Dr. Ali Khan, who'll chat with me about better health tips for seniors.
Thanks for having me.
You know, when we're thinking about taking care of our seniors, the seniors in our lives, there's so much on the table, right? Can we talk a little bit about how important those preventative care appointments are?
I mean, those preventive care appointments, Keisha, which I spend a lot of time in clinic with senior patients on exactly this, are incredibly important, right? Because these are the appointments that are the foundation of staying healthy as we get older, right? Whether it's that Medicare annual wellness visit where we set up the playbook, the plan for the year ahead to understand what things we want to do month by month to keep people healthy, or whether it's that annual physical that's far more than a checkup but is really a place where we're doing a robust physical exam, getting labs, vaccines, all the preventive screenings to put the picture together of identifying problems early before they can get out of hand and get a treatment plan in place. Those are so critical that, for us in Medicare Advantage plans like Aetna, we cover that kind of care at no additional cost because of how critical it is. And the message we really want to make sure everyone's listening to today is to say, get those appointments scheduled early in the year so that we have the whole year to do the work that's necessary to keep you happy, healthy, and at home.
When we think about trying to be proactive, is there a list? Should we, stick it up on the parents', bulletin board on their refrigerator? Is there kind of a list that we could go through just to make sure that we're covering all of our bases?
Yeah, Keisha, I think of this like car maintenance, right? I've learned the hard way not to wait for the engine light to come on to check my oil, right, or to get it changed. So when the same principle applies to your health, and so I think this kind of checklist becomes super critical. So my top three must do for seniors, very critically. Number one, first and foremost, schedule and get completed those preventive care appointments, right? That annual wellness visit to get that playbook, that routine physical exam to catch issues in real time before they get out of hand. Like we don't want people to wait until they're sick to see the doctor, right? Those preventive visits they're covered by the plan, no additional cost because they're the key to staying healthy all year long. And let me give you one really granular piece of this, if I may. One of the most important things we can do after the age of 60 for our parents or even for ourselves to make sure that our memory and our cognitive skills stay really sharp and we don't progress to dementia is getting our eyes and our ears checked every single year, right? Annual hearing and vision screenings catch the small drop in hearing where hearing aids can be a big benefit, right? Or the small changes in vision that means you need to finally put on glasses. But when we don't do that, people withdraw from social care, for social commitments. People stay at home more often. They're not engaging with reading or writing, all that stuff that can lead to memory issues downstream. So that number one, getting those preventive care appointments scheduled and completed is so important. Number two, getting to know your plan, right? Reading through what benefits are available to you, understanding what's covered and not covered, and identifying the extra benefits like a 24/7 nurse line or additional care management programs when you're coming out of a hospital that you're often due for, but you might not know you have. So when we're calling to tell you that you have access to them, you think it's another crank call and you don't pick up the phone, right? Third, everybody's digital, everybody's on smartphones. Register for that portal, download that app, and become an empowered advocate of your own health because you can see here's my prescriptions, here's my appointments, here's my doctors, here's all the stuff I got to go get done, and here's my checklist of what to do, right? So those three together become a powerful tool for being an incredibly effective advocate and agent for your own health.
Is there a place that we can go on the web that'll give us some tips?
Yeah, there's a lot of great places on the web. I tend to refer folks over to Medicare.com just for that exact view that you laid out. Simple, unbiased, a list of resources of what you need to access, things to consider as you're thinking about what kind of Medicare plan to choose, and the kinds of things you need to know to be invested in your own health and what to keep on your own radar. Now, I want to make sure I leave it clear here. We're not looking for you to advocate alone. We, from a health plan perspective, we as your doctors and nurses, we are here to work with you and to be partners in that journey. And so that's why I'm saying empowering you with as much information as you need and then making sure that we have the same through whether it's websites like Medicare.com or through those patient portals, through those apps. Together, we can make sure that you're not worrying alone. But I want to give the roadmap of how you make sure you can raise your hand and ask for help.
Dr. Khan, thanks so much for your time. It was a pleasure to meet you.
Likewise, thanks so much for having me today.
Absolutely. All right, guys, there is a plan, there is a map. Sometimes you just have to, get your research done and set a plan for yourself and your family members. But take the opportunity to go to the website and learn more. And stay tuned to more Focus Atlanta. We'll be right back.